Soon you might be on your own to find the right Medicare Part D prescription drug plan. This video will walk you through how to do that, whether you don't take any medications, only take a few inexpensive medications, or if you have a longer medication list that includes more expensive drugs. First, here's some background on what is happening with Medicare Part D. There have been a lot of changes to the Medicare Part D program due to the passage of the Inflation Reduction Act. Some of those are helpful. The $2,000 out-of-pocket cap on prescription medications for consumers, and the ability to spread the payments for your medications out over the year instead of having high costs at the beginning of the year. However, there are also some unintended negative consequences, especially for the standalone Part D plans. So who has standalone Part D plans? Usually it's someone who has original Medicare Parts A and B and a Medigap plan, which is also known as a Medicare supplement. Medigap plans don't cover drugs, so these are the folks who need a standalone Part D plan for their drug coverage. The $2,000 out-of-pocket limit for consumers on Part D drugs places more financial risk on the insurance companies to pay for expensive Part D medications. In order to mitigate that risk, insurance companies made several changes for 2025. First, drugs that used to be covered have been removed from covered drug lists by some Part D companies. Also, many low and mid-price drugs have gotten more expensive for consumers. And many Part D insurance companies have chosen to stop paying commissions to agents and brokers who assist people in finding and enrolling in standalone Part D plans. Going forward, many independent agents and brokers will no longer be helping people find standalone Part D prescription drug policies. In our case here in the office, we will continue to help our clients find standalone Part D policies as long as they purchased their Medigap plan through our office. Part D plans need to be looked at not just when you are starting Medicare, but every year during the annual enrollment period. Part D is arguably the most confusing part of Medicare, so this video is going to walk you step by step through how to find the right Medicare Part D policy for you, whether you are new to Medicare or it's annual enrollment time. So first we'll go to Medicare.gov. And then we are going to choose Find Health and Drug Plans and click on Find Plans Now. If you have an account on Medicare.gov, go ahead and log into that at this point. It is useful to create an account once you have your Medicare number. It will track your explanation of benefits and also keep your drug lists from year to year. For now, though, we will continue without logging in, and we're going to put in a Chicago zip code 60601. Then the type of plan we want is Medicare drug plan. And then we click on Find Plans. If you do qualify for Medicaid or the Extra Help program, make sure that you click that when the screen comes up so that you get accurate pricing information. For this example, though, we're going to say that we don't get help from any of these programs. All right, so now here is where we're going to do three different examples. So we will have our first example, which is a person who takes no medications at all. The second example will be a person who takes some pretty standard, less expensive type medications. And then the third time through the quoting will be more expensive medications that are more likely to have restrictions. So we'll talk about each of those. So first, if you don't take any medications, when you get to this screen, you would choose no. You don't want to see drug costs because you don't have any. So we can click on no and then next. And then as you are looking at these plans, you want to make sure that they are sorted by lowest drug plus premium cost. Of course, in this case, if you don't take any drugs, you don't have any drug costs, but this is always the way that you want to sort these. The other options for sorting the plans would be lowest yearly drug deductible or lowest monthly premium, and those aren't useful information. So you can just leave it as lowest drug plus premium cost, and then in this case, for somebody who takes no medications, you have a plan at the top here that has a monthly premium of $0, and your total drug and premium cost for the rest of 2025 is also $0. So in this case, if you take no medications, this is the plan that you would want to choose. To enroll in this plan, you would simply click the green enroll button on Medicare.gov and then follow the instructions from there. If you do take medications, when you get to this screen, you would choose yes, that you do want to see your drug costs when you compare plans. And then when you click next, it will give you the option to start putting in your medications. So we are going to put in a few common ones that are not very expensive. So the first one, rosuvastatin, and then we click add drug. And then it is very, very important when you are putting your drugs in. This is probably the most common error, is that people will type in the brand name drug when actually they take a generic, or they'll put in the wrong dosage. Make sure that what you put into the quoting system matches exactly with what is on your prescription and on the medication container. If it doesn't, if you put in a brand name when actually you take a generic, your pricing is going to be wrong, and the recommended plan is probably not actually going to be the best one for you. So make sure, be very, very careful. All of the information from your prescriptions has to match what you're putting in the system here. Otherwise, you won't get good information and you might make a wrong decision about a plan for Part D. So let's say that our dosage with this particular medication is a 10 milligram tablet, and then we take it once a day, but we don't refill it every month. We get a 90-day supply. So we're going to change that to 90 and make it every 3 months and add to drug list. So let's say that there's another drug that we take, and we're going to use metformin. So with metformin, this is a good example. You have all these different combination medications first. If you don't take one of these combo medications, don't click on that, don't add that. Scroll down until you find the one that you actually take, which is right here, and then we'll add drug. And then it always comes up with the most common dosage. If you take some other dosage though, make sure that you change it to what you actually take. And also, very, very important, if you take a tablet that's extended release, or tablet, or instead of a capsule, make sure everything matches exactly when you're putting it in the system. Again, otherwise you will have wrong information. So let's say we take this twice a day, but it's a 90-day refill, so 180 every 3 months, add to drug list. All right, so let's say we're done adding drugs, and then we want to add our pharmacies. So we are going to add a few. You want to add pharmacies that you actually use or want to use so that you can get accurate pricing information for each insurance plan for those particular pharmacies. So now it will sort the plan. And again, when you're sorting the plans, make sure you're sorting by lowest drug plus premium cost. That will rank the plans in order of lowest to highest overall cost for your particular medications through the rest of the year. So in this case, we ended up with an insurance plan, a standalone Part D plan that has a $0 monthly premium. And because those two medications on our list are inexpensive generics, it's also $0 drug cost. However, anytime you put medications into the system, you have a little bit of extra checking that you need to do before you enroll. So we are going to click on Plan Details. When this opens up, you're going to scroll down, check your pharmacies. All of the pharmacies we put in are preferred in-network pharmacies. That is good. That means we're getting our best price. Here are the yearly drug costs by pharmacy. In this case, it doesn't make any difference where you fill your medications. And the estimated total drug plus premium cost based on the pharmacy. There is one other thing that we always need to check. It's right here, View More Drug Coverage. Click on that. And this will give you the information about any restrictions that might be on your medications. A prior authorization restriction means your doctor has to talk to the plan, before the plan is going to cover that medication for you. A quantity limit is pretty straightforward. They will limit the number of pills or the number of doses that a person can get within a specified time, 30 days, 90 days. And step therapy means that the insurance company is going to require you to try and fail on a less expensive medication before they will cover the medication that your doctor would like to prescribe for you. So with any of these, if there is a restriction, double check. For this, the quantity limit, it doesn't matter because our prescription is under that quantity limit anyway. Same thing for this one. If you do have a prior authorization restriction or a step therapy restriction or a quantity limit restriction that does affect you, usually those don't affect people. But anytime you have any restriction that is going to affect your ability to get your medications, make sure you talk to your doctor. Give your doctor a heads up. I'm moving to Medicare soon. I found a Medicare Part D plan. These medications have these restrictions. We need to be able to work with that. And sometimes that just means the doctor contacting the plan to get that prior authorization request granted to cover the medication. Other times it means finding a substitute medication, because there are some times too when a medication won't be covered by a plan at all. And then you would have to pay the full cost of that medication if a substitute can't be found. If your doctor wants to, you can try to request a formulary exception in that case. Those are typically a little bit difficult to get though. So in this case, we're not affected by the restrictions at all. So then what you would want to do before you just sign up for this plan, because there can be errors on Medicare.gov, I recommend that you go to the website of the insurance company that runs this plan and double check there that the information on the pricing and the restrictions for your medications matches what you saw on Medicare.gov. If it does, if everything is correct, then you can come back to Medicare.gov and you click on the green enroll button, which is right here, and follow those instructions. Then you will be enrolled for the rest of 2025. Now, one thing about calling insurance companies, why go to the website instead of calling? Well, because if you call the website, understand you are calling their sales department. If anyone in the sales department gives you wrong information, the insurance company is not going to stand by that wrong information. So if they tell you, say, a wrong price for your medication, they will not stand behind that. So when you are checking to make sure that the information on Medicare.gov is correct, go to the website of the insurance company. They have to stand behind what they have written on their website. They don't have to stand behind what the people in their call centers say. So that is my recommendation to you. Make sure you're checking on the website to double check that information. All right, so that was a relatively straightforward estimate. Let's try one that is a little bit more complicated. Okay, so we are going to add Ozempic to our list. And again, make sure that you are putting in the actual dosage that you take. And we'll make this a 3-month supply also. And we're leaving the other generic drugs on there for now. Let's add one more. We're going to add an inhaler. And in this case, we'll just leave it at the standard, but we will increase this to 3 for a 90-day supply. All right, we'll also add some insulin. This is where Medicare.gov can be very helpful. We typed in a brand name and it is saying, hey, there's a generic. Would you like to see the less expensive? Most likely your doctor has you on the generic, so we're going to say yes, add the generic. And we will leave it as the pen injector. And again, change it to 3 months. Okay, we're done adding drugs, and we will select our pharmacies again. And again, sorting by lowest drug plus premium cost. So this time you can see it is not a $0 premium Part D plan. It is a much higher premium per month to be in the plan. However, this plan ended up being the lowest overall cost for this particular drug list. That can happen. If you take more expensive medications, sometimes it is worth paying a higher monthly premium for a Part D plan because it lowers your copays for your medications. Don't assume that though, and just buy an expensive plan. Make sure that you are actually doing the quoting to confirm which plan is going to be best for you and the least expensive. So let's just compare this one that came out on top to one of the $0 monthly premium plans. Okay, as you can see in this plan comparison, the drug costs for the plan with the lower monthly premium are much, much higher than for the plan with the higher monthly premium. So that's where the difference comes in, and that's why you always want to look at the overall cost for your particular medications, not just the price to be in the plan. That is very misleading and not terribly useful information. You want to know what your costs are going to be with a Medicare Part D plan. And here we can see what some of the problems are. Part D prescription drug plans do not have to cover all medications. And in this case, both the insulin pen and the inhaler are not covered by that $0 premium Medicare Part D plan. So that's why this plan is really not a good choice if this is your medication list. And then get in the habit of always clicking on View More Drug Coverage. And in addition to those two medications not being covered, we also do have a prior authorization for the Ozempic. And I know just from running quotes, most of the plans, virtually all of the plans, are going to have a prior authorization restriction for that. That does not mean that the plan won't cover the medication. It does mean your doctor has to contact the plan and talk to them before they will cover it for you. So this is why the prices are so much higher with this plan, because you have these two medications from your list that are not covered. So let's go back and look at the plan that is recommended and look at the more coverage details there. Okay, so we are back to the more expensive Part D plan, clicking on View More Drug Coverage. And in this case, all of your medications are covered. That is good. You do still have a prior authorization restriction on the Ozempic, which is on virtually all of the plans, so no surprise there. This would be one to let your doctor know that you are going to have this prior authorization restriction coming up once you are eligible for Medicare and on a Part D plan. In this case then, what you would do next is go to the insurance company website. Again, make sure that all the information that you found on Medicare.gov is correct. If it is, then you can go right to that green enroll button again, click on that, and follow the instructions, and you will be enrolled for the rest of 2025. Now, as you can see, because there's the possibility that drugs will have restrictions on them or not be covered by some plans, it is a good idea to start running these quotes several weeks before you need the coverage to start, just in case you have to have a conversation with your doctor or look into alternative medications. This will give you enough time to be able to do that. So this video took you through 3 different examples of how to find your own Medicare Part D prescription drug plan, whether you take no medications, just a few medications, or more medications, and medications that are expensive and have restrictions. I hope this was helpful for you as you are finding your own Medicare Part D prescription drug plan. If it was, I invite you to please like and subscribe if you haven't already. As I mentioned earlier, we are still helping people find Medicare Part D plans. However, we are limiting it going forward to people who also have purchased a Medigap policy through our office. If you do have Medicare questions, feel free to give the office a call at 877-312-1414. Our goal is to make sure all Medicare beneficiaries know what their options are and understand how to find the right Medicare coverage for them. Have a great day.